Yo, this Doc P Vagina Monologues. Let's talk about it. Patience. Let me tell y'all something. I'm the biggest advocate for patience. I am the biggest advocate for, you know, finding a doctor that's going to take care of you and is going to treat you like you need to be treated and give you the information that you need to be. I'm the biggest advocate for patience. But with that being said, let me tell you something. If you go to the hospital, you go to the emergency room or you get admitted and you choose to leave against medical advice or AMA, I have zero sympathy for you. No sympathy, because it's not Burger King, okay? Hospitals are not Burger King. It's not have it your way, right? You can't go in there and think that it just goes like that and people are going to jump and do whatever you need and whatever you want when you want it, right? You are only hurting yourself if you leave against medical advice. I give you an example. I had a patient that had an ectopic pregnancy. Now, mind you, she got admitted with her ectopic pregnancy and she needed surgery. It wasn't urgent. She wasn't in acute danger at the time. But at the time, I'm dealing with a bleeding patient, a patient that is bleeding profusely that I'm trying to save because she's bleeding. Now, this other patient that's sitting there and waiting on me to come has no idea that I am dealing with another patient, but yet still you pissed off. And I understand that. However, you leaving against medical advice only hurts you. It doesn't hurt the doctor. It's almost like my kid, like my child. If my child say, "Daddy, I don't want dinner. I ain't gonna eat dinner. I'm just gonna go to bed hungry." And go hungry. You're not gonna hurt me. You're gonna hurt yourself. So don't go to the hospital thinking things are just gonna go your way. And more so, do not leave against medical advice, especially if you have some horrible situation going on. I'll give you another example. I had a patient that was severe preeclamptic, needed to deliver a baby. She didn't think, just because she felt fine at the time, she didn't agree with what I was telling her. So she said, well, I'm just going to leave and go against it. You will stroke out. You're going to go, your baby's going to die, you're going to stroke out. And this is what happens with our community. And we wonder why healthcare disparities happen or what have you. Healthcare disparities, I agree. It has a lot to do with racism. It has a lot to do with inherent bigotry, all of that stuff. You know, you go back to and you look at the 1619 Project from the New York Times. You look at all of that stuff and it explains the origins of, slavery, healthcare, why we have disparities. All of that stuff is accurate. However, fast forward in 2020, a lot of that stuff, now it's us. It's us hurting each other. And you thinking that everything is supposed to go your way and you don't understand how hospitals work. I tell people all the time, even in my clinic, when you go and you're waiting, like in a clinic, right? You thinking that nothing, people are just ignoring you and it's not going on. I tell my patients all the time, you don't want me to microwave you, right? You want me to take the time that you deserve to answer all your questions, to make sure that everything is done properly. You don't want me to microwave you, right? So the 15-minute slot that you get that I'm supposed to see you and then go to the next patient and go to the next patient, that's how insurance is wanted. That's how we have to, our schedule to microwave people so that, keep things moving and actually get paid for it. I don't operate like that. And the good doctors, they don't. Because if you need, I'm not going to leave until all of your questions are answered. And you feel comfortable with the care, you feel comfortable with the plan. That might not take 15 minutes. And if it doesn't, guess what? I may be a little late, or that doctor may be a little late to come and see you to take care of you. But you want that same courtesy that they're giving that patient that caused them to be late with you, because you want them to, or you want me to listen to everything you got to say. And you don't want me doing like this, saying, all right, you got 5 seconds. If you don't answer this question here, I got to roll. You don't want me doing that. You don't want anybody doing that to you. So before you make a rash decision about waiting, or you make a decision to leave, or just saying this place is trash because I've waited so long or what have you, I agree. Sometimes there's negligence. Sometimes things are just not taken care of the way they're supposed to be. That's a feeling that you can see. You can see that. You can see how doctors take care of you. If you've been waiting for hours, or you waiting for half hour, whatever, and then you get the doctor in the room and they're not listening to you and it's just a trash visit, then I can understand that. However, if you've been waiting and then the doctor comes to you to answer all your questions, they're taking the time with you, they're taking extensive care with you, realize that extra time that they gave you, they had to give somebody else. So it's not efficient, but it's great care. So realize that. Think about that. Leaving against medical advice is whack. Don't do it, right? Especially if you have an issue that may cause you your life. The patients that I'm telling you about can die. Had a patient with an ectopic pregnancy that needed surgery, and because I didn't come see her just like that, she left. Now, if she goes out and that gets ruptured, like her ectopic pregnancy ruptured, guess what? But it's nobody's fault but yours. But you're going to say the hospital was whack, the doctor was whack and all of that. It's not. You got to look in the mirror. You got to face facts. So that's my spiel for today. Realize that, we have to be advocates for ourselves, and realize that hospitals and doctors are not like Burger King. It's not microwave. You want people to take time with you. You want people to take care with you. Realize they have to do that for the next person too. And it may not always be efficient. It may not always be when you want it to be. And if that's the case, and they're doing that for every single person, have some compassion and understand what's going on. Doc P, I'm out.